more women are choosing a midwife to assist in their childbirth experience. But what exactly does a midwife do? Here to help us sort it out is certified nurse midwife Erin Bane, who works at Backus and Windham hospitals. Erin, welcome.
Hi, thanks so much for having me.
Thanks for being here. So what is the role of a midwife?
So the first thing to know is that there are a few different kinds of midwives out there. I'm a nurse midwife, as you stated. There are also certified professional midwives, there are certified midwives, there are lay midwives. It can get a little confusing. My role is trained to deliver in hospitals mostly, and I can do deliveries without pain medication. I'm also trained to provide all sorts of reproductive health care. So when you need an annual exam, a gynecological problem, you can come and see me. You can come with physicians to make sure that I have a person who's really trained in case something kind of goes beyond what I know how to do. But I really regard my real role as being able to listen to you, talk about your body, and then help you navigate kind of what comes next in your care. It's really a knowledge sharing and a conversation when we...
Wow, it sounds great. So how is a nurse midwife different from a doctor?
Well, we're trained differently. So as a nurse midwife, I was a nurse first. I was a labor and delivery nurse for about 5 years. Prior to that, I did some medical surgical. But nurses are really specifically trained to look at a whole person when we're taking care of them. So I want to hear everything about what's going on in your life, how your stress is affecting you, what your diet is doing. I want to look at more than what you're just coming in for today, because it might all kind of fit together. The other thing is, obviously, doctors have a little bit longer of a training, and they're surgeons. And so when you come to see me, it might be that I see you and I say, hey, you know what, that is really important, and I really think we need to talk to a doctor about that because it kind of goes beyond my scope.
Okay. So midwives don't only assist in the birth experience. Tell us about
Correct.
what other ways you treat women.
Yeah, so the other ways I treat women is, like I said before, you can come to me for your annual exam. You can come to me for any kind of, well, related to my specialty, right? Any kind of problem, really. Most women out there don't necessarily need a physician, especially if you're mostly healthy. And so midwives really play this role of providing a different avenue for care, and also, if there are complex issues, leaving space in a physician's schedule really to take care of those more complex issues.
All right. And Erin, finally, tell us about how the role of the midwife has evolved over the years.
This is such a complex question. When you ask that question, I think mostly about the long history this country has with midwifery and how it started. Midwives in this country back in the 19th century were mostly immigrant people, people of color, not the kind of people you see being midwives now. And so there's a long history with like some racism intertwined and systemic medicalization of birth and reproductive health care. That aside, what I can say is that we have gone from kind of that home birth situation, which a lot of midwives still do, those certified midwives and licensed midwives that I talked about before. They do a lot of home birth and birthing center work, to being able to accommodate women who want midwife care, but also maybe need to come to the hospital to have their baby or prefer to have an epidural. And so that's how the changes kind of happened over the years.
All right, Erin Bane, we have to go. We're out of time.
Okay, yeah, thanks for having me.
Midwife, thanks for bringing us up to date. Great information.
Yeah, have a great day.